We all have fond memories of doing something for the first time. Our first day of school, our first time driving a car, the purchase of our first home. Memories like these have a powerful, lasting effect. They stick with us over the years, turning into defining moments that shape our life story. A positive first experience with something can make a meaningful impression that lasts a lifetime. We want to make sure your first experience with MR is a great one. That's why we built Signa Prime. It's easy to learn, yet powerful to use. From sighting to your first scan to every scan, Signa Prime will help make your first MR one to remember.
My name's Mohammed Al-Demirdash. I'm the Chief Technology Officer for MRI at GE Healthcare. You know, one of the biggest challenges we had as we designed Signa Prime is to get everybody out of their comfort zone. We had to challenge the entire organization. MR does not have to be difficult. MR does not have to be for the fully trained. MR can be for anyone. Signa Prime is going to help emerging markets access MR because it was designed with those customers in mind. Working for GE Healthcare outside of the US, in Africa, in India, in the Middle East, in Southeast Asia, further solidified how I put forth my designs in MR and what we focus the teams on. Signa Prime is very unique from a sighting standpoint. And we've really focused on making sure that every customer, every location is going to be able to get a Signa Prime and sight it in their location. We used as much green technology as we could in the design of Signa Prime. It has the smallest footprint in the industry. It consumes very low power, and you will not have to concern yourself or worry yourself with helium or helium refills on this system.
We knew it would take several months to install the MR machine. I saw the whole process from the beginning to the end, how the installation happened, and it was very impressive and faster compared to the previous 3 MRs that we've had.
I'm Zuli. I lead the 1.5T global MR segment here in GE Healthcare. I spent 5 years learning in grad schools about how to control MR scanners, so make it easier for our users to use it properly is very, very important. The user interface for Signa Prime, if I would sort of highlight what I feel and the key aspect of the user interface, I think is very simple, very powerful, and is very intuitive. So our UI, even for the technologists who have not used MR scanner, all the key parameters are always just in front of them in these very well-organized few key tabs. The technologist could just follow what's on the screen and prescribe an exam without any significant challenges. We also had our first pilot systems being installed in India. Granted, this technologist has used MR before, but it's a complete new system. But we didn't give him any training, and he was able to follow the screen and just get the exam done.
I was asked to just start a scan one day, and I was able to do it. The user interface in Signa Prime is just like using a normal PC at home. Even a junior technician can come and use it with the express mode.
One of the reasons why we are very happy with Signa Prime is the user interface, definitely. It's one of the simplest and one of the easiest to handle. Compared to all the other user interfaces which I had encountered in my career, I felt this was one of the best. And everything was in the form of a drop-down menu, and the express mode was even simpler. It was just like a piece of cake. Something very impressive is the 3D hypercubes, and I feel if properly done, it could replace the other 3 orthogonal planes and reduce about 12 minutes of our scan time. I personally feel anyone and almost everyone can use it irrespective of their level of experience. You just need to choose what you need, and once you make your choice, you just have to select it and go ahead. The machine does the rest.
I think it's quite user-friendly. Our MRI technicians are quite experienced, and they have been very pleased with the ease of operations and the ease of being able to use it without a great amount of training
the image quality coming out of a product that's intended for a first-time user. You have an expectation that there's a compromise, but we insisted as we designed this product that there shall be no compromise. That has been really the key driver for us. Use artificial intelligence to improve the customer experience and how they use the system. It's based on the same artificial intelligence reconstruction techniques that we have across our entire portfolio, which has proven itself to provide better signal-to-noise ratio and improved outcomes for clinicians.
Artificial intelligence will help, especially in specific situations related to dealing with artifacts, improving some protocols, and providing a better experience for patients by reducing the time spent in some more difficult protocols.
I feel definitely whether it is a budding radiologist or an experienced radiologist, it can definitely help in the overall diagnosis and decision making.
The image quality is very important because they will be a direction to the treatment to the patient. And some kinds of exams we perform in 3 Tesla machine. And Signa Prime has some features that we can be perform these exams in this machine. And some people here in Brazil don't have access to the 3 Tesla machine. And we could be performing these exams with quality in the Signa Prime.
The images are so clear, especially when it comes to the spine, the knee joint, the hip joint, as well as the shoulder. You know, the shoulder is always been a problem with MRs. This clarity is very good to pick up very fine injuries that we would have missed. It's easier to get a correct diagnosis, a better diagnosis, and to show the patient the image right in front, how clear it is.
Signa Prime is unique about its power to provide broader access to our patients to the MR scanners with its simplicity to use, simplicity to install, and always provide such robust image quality every time.
The beauty of Signa Prime is that the system can grow with the user. Not only will you be able to get new applications and new enhancements remotely downloaded directly onto the system as you expand your capabilities, but as you expand your practice, you will be able to enhance the system and upgrade it to 70 centimeters.
I personally feel if they are going to consider Sigma Prime, they should just go for it. It's not that you buy this and you're done with it. It's going to be growing with us, and with every update there is going to be improvement. There is going to be scope for better scans. There is going to be scope for clinical research. I feel the possibilities of imaging is quite endless.
You know what I love the most about Signa Prime is that a first-time user right out of the box can create an image that looks just like that.
Signa Prime is part of a new generation equipment that, in addition to its importance in terms of sustainability, offers options of protocols that allows for the technician to devote himself to patient care. And this is something very important for us because the patient is in the center of everything that we do.
Whichever hospital is looking for a new MR, this is the best one.
If you strive to offer the best healthcare for the community you serve, you are ready for MR. Whether you're a healthcare executive, technologist, or radiologist, we built Signa Prime to make sure your first MR experience is a great one. Easy to set up, easy to use, easy to read. This is Signa Prime.